Well, hi everyone. My name is Joel Rubin. I would much prefer to be doing this presentation on campus, as I'm sure all of you would like to be on campus. But at this point, you probably all just want to be graduating and done with everything. So I'm, as Rachel said, I'm the state director of NASW. I've also on and off taught at UIC Jane Addams, which is my alma mater, for many years, for close to 20 years. Variety of different courses. I don't know. I just can't see who's all on the call. Perhaps some of you were in my 554 class last semester. But so let's get going. I really want to maximize the time we have. So what I'm going to do is I'm going to go through a lot of information. And then what I'd like to do, I think we got till 5 o'clock, is then I would just like to get through this and then just take questions. Because I know that there's a lot of questions that will come up. Maybe some of them will be preempted by some of my comments. And interspersed too, I'll be going back and forth to things about the job market too, because in many ways some of this stuff is related to that too. And so that's the story. So okay, so let's get started. So a little background, a little history. Always important to know your history about where we've been as far as a regulated profession here in Illinois and the country as well. We're a regulated profession in the United States, and in Illinois, we've been a licensed profession since 1989. It may seem like ancient history to some of you, but it's really that's not a lot. It's not a long time to be a licensed profession. And the primary purpose of licensure, social work licensure, is to establish a statute. Um, to establish in statute a set of legally enforceable minimum standards to which social work licensees are held accountable. Okay, so here in Illinois, and you may hear people refer to our social work licensure statute as a practice act. So I may, be using these terms interchangeably as well. And another really key important piece about social work licensure is that it is designed to protect the public, and that's basically consumers of social work services that are provided by social work licensees. So they have some kind of assurance of the competency of social workers. Okay, so it's a little bit of history. If you really want to know why there was a major push to get everybody licensed in the 1980s, obviously with the advent of managed care and healthcare, that was a major push. Up until the mid to late 80s and early 90s, there was one sort of, in some ways, a gold standard of, it wasn't a license, but it was a certification from NASW called the ACSW. If you see some of the old timers have that on their business cards or their email signatures, that stands for the Academy of Certified Social Work. And it was a certification that was thought of so highly here in the state of Illinois that in the first year that we were licensed, if you can actually take a look at this in the actual statute, if you had the ACSW, you were grandfathered in. There was a window of time that if you applied for licensure and you had passed the ACSW test, you didn't have to take the LCSW test. So kind of interesting. I know you're probably saying, why in the world is he talking about this history? It's important to know these things, etc. So, all right. So let's get going. I'm here talking about social work licensure. I don't represent the Illinois Department of Financial and Professional Regulation. Sometimes I feel like I do, because we at NASW, we do a lot of sort of running interference and helping people navigate the process. IDFPR is a state agency, which is very much under, they do not have the bandwidth that they really need to do their job to to the fullest. And I rarely stick up for state agencies, but honestly, they really, as some of you perhaps have even experienced, it's really hard to get a hold of IDFPR, etc. So, um, so here's the actual what our statute requires is that Illinois statute requires any person engaged as a social worker, except in some cases if employed by the U.S. government or in some cases by the state of Illinois, and only if verified by IDFPR, must be licensed. No person may represent her or himself as a licensed social worker or licensed clinical social worker without obtaining the proper license. So I guess the takeaway from this slide is don't try to cut corners because this is pretty serious stuff with a license. And we fought very hard many years ago to become a licensed profession here in the state of Illinois. All right. Some of this may be review, and most of you know that we have 2 levels of licensure here in the state of Illinois. It may be different. It is different north of the border in Wisconsin. It is different in other states, but here we have 2 levels of licensure. One is the licensed social work level of licensure, which is the level of licensure that you can already attain following graduation. I'm assuming most of you are graduating in May. And what is really the terminal level of licensure here in Illinois is a licensed clinical social worker. LCSWs cannot practice independently. LCSWs can engage in clinical social work practice as long as it's not conducted in an independent practice as defined in our licensure statute. LCSWs are authorized to practice independently, independently practice clinical social works here in the state, whether it's for an employer or in private practice. And we're going to go into, in just a second, what are the different requirements, etc. All right. All right. So these are the 2 different sort of, and I'm going to send this. I'll send a PDF of this deck to Rachel as well, and she can send it out to all of you and for anyone, any of your colleagues and classmates who were unable to participate today. These are the 2 requirements for the LSW and the LCSW. The LCSW, and obviously this doesn't pertain because you're getting your MSW, is a level of licensure that you can attain in the state of Illinois without any supervision hours. Okay. You basically need to be, as it says, you need to graduate from an accredited school of social work. And don't worry, Jane Addams is an accredited school of social work by the Council of Social Work Education, which accredits all social work programs across the country. And obviously on both of these applications, there's a whole clause that says you have to be of good moral character, which I'm sure all of you are. The LCSW is the sort of terminal level of licensure in which, in order to get the clinical license, you have to complete 3,000 hours of clinical supervision. Okay, so 3,000 hours is approximately 2 years of full-time work. All right, so just to preempt a couple of questions, no, unfortunately, you cannot receive any clinical hours for your internship. That's 1. 2, the clock starts to run once your degree is conferred by the college post-graduation. All right. And we're going to get into sort of different ways to get supervision, et cetera, and I think coming up right in the next slide. All right, so here's a little bit about supervision and clinical experience. Your supervision, not who you work for, has to be from an LCSW. This is for the clinical exam. All right. So if you you graduate, you get your first job, and you start to work for agency Y. The person who you report to or your boss, she can be a PsyD, she can be an LCPC, she can be an MBA, she can be anything, okay? But she can't uh, supervise you clinically. That has to be done by an LCSW. Um, so, um, and that clinical supervision can either be full-time or it can be part-time. Um, whether it's full-time or part-time, the work has to consist of client contact or administrative work directly related to client contact. Okay. So I know once in a while it can be a little bit of gray area. It depends. When you encounter that, please do not hesitate to reach out to us at NASW, myself, and people can provide some guidance around that. But you can't get your clinical hours because you start a job and your boss feels that you really have great tech skills. So hey, how about redesigning the page for the clinical page on our website? That's great. It could very well be that would be included in some of the things you do in your new job, your first job, but it's not going to be considered clinical supervision. All right. Um, with supervision too, you can have different supervisors at different times. Okay. So what happens sometimes is that you may start a job and your clinical supervisor at your job, she or he leaves for another position. You can get, as long as the next person who's supervising you is an LCSW. Now, here's another issue. Some of you may be offered a sort of really cool job, sort of a, for lack of better words, sort of a not-for-profit startup in which you'll be doing clinical work, but there's absolutely no clinicians on staff. That means that you're going to have to find a clinical social worker to do your supervision. Now, that's not insurmountable, but what it will require is for you to find someone and but most likely have to pay for that supervision as well. So here's my first piece of unsolicited job advice when you hit, as you are now, and most of you are starting to look and all this other stuff. None of us, including myself, who started my career a million years ago, your first job is not going to be your dream job. Here and there, it may be the case, but you may also want to consider that a larger agency that perhaps wants to hire me, I can get my clinical supervision through someone who is working there. Okay, and in fact, sometimes agencies really sort of promote that this is sort of a real benefit of working here. We provide great supervision, and you also sort of have to monetize that, because if you went to start that really incredible job, a new opportunity, working for an agency, and find a clinical supervisor, that's going to cost you per month. So you have to sort of weigh those things. That's an individual choice, but I just really wanted to point that out as well to everyone too, because I think that's something that you need to sometimes weigh to say, okay, this may be exactly what I want to be doing for the next 2 to 4 years, but I know I'm going to get great supervision at this job, and boom, I get my clinical hours. I can sit for the clinical test and hopefully pass it, and you're done. So anyway, just a little bit about that. Just a couple of last minute things too. You can get your clinical hours by doing volunteer work. You have to meet 4 hours per month with your supervisor, either individually or in groups of no more than 5 persons. Okay. All right. This slide is still in this deck, but I think it's still important to mention it. Some of you may know that last year, actually in 2019, Governor Pritzker signed an amendment to the Clinical Social Work and Social Practice Act that we thought beginning last year, January 1, Illinois social work students that were currently enrolled in their last semester of a master's level social work program would be able to sit for the LSW exam without pre-approval. Okay, the licensure exam, you have to get pre-approved to sit for the test. It's a rather, it's a long process. So pre-COVID, that process would take 8 to 10 weeks. And we were looking for a way to really make sure that students would be able to actually take the test. And once their degree is conferred by, Jane Addams or whatever school it is, that once that happens right after graduation, if you had passed the test, boom, you can get your LSW because you've already passed the test. Okay, there's always hope, and we had great intentions that this was going to take place. Unfortunately, we ran into a real problem with the Association of Social Work Boards, which I'll talk about in just a little bit. Basically, ASWB and our Illinois Department of Financial and Professional Regulation have still not worked this issue out. It's been terribly frustrating. As a result, it didn't apply to any of you who are in your last semester of your MSW. I'm hoping that your colleagues and fellow students that will follow you a year from now, that will be the case. So stay tuned. But I just wanted to put that in there as well. It's sort of welcome to my world of working with state agencies and the legislature and all that other stuff. So. All right, so testing, and I mentioned the Association of Social Work Boards. So the Association of Social Work Boards develops and controls the test in every single state in the union. Okay? That is usually called a monopoly, but they control the test. They're not a governmental agency, they're a testing body. So, so when you get pre-approved to take whatever test you're thinking of taking, whether it's the LSW shortly after graduation or eventually LCSW, the test that you're going to take is administered by the Association of Social Work Boards. And you take those tests at various sites through, in the state. Basically, you're taking it on a computer. You got 4 hours to take the exam. You know what the result is immediately following completion of the test. Those exam results can be taken in any state and then can be sent to any state as well. So if you're in Illinois right now and say you want to, you're thinking of relocating very shortly to another state, you can have those test scores sent to another state. All right. Now, there is no limitation to the number of times you take the test. However, if you do not pass it on the first time, whether it's the LSW or the LCSW, you have to wait. You have to wait 90 days between taking the exam. All right. In other words, the test is a national exam. All right. So, and now every state uses it. Up until about 4 years ago, California did not. But now every state uses the ASWB exam. All right, don't shoot the messenger. But these are the fees associated with the application to the Illinois Department of Financial and Professional Regulation and the testing fees. Now, here's my second unsolicited advice when you're interviewing and all that other stuff. It's fair game to say to an employer to say, you get a little further on to the, in the process to say, look, I'm really interested in your agency. really interested in doing whatever. Say it's clinical work. I eventually want to get my LCSW. Does the agency would the agency help with the cost of that? Okay. Um, there are two answers to that question. Whoever's interviewing you can say, no, we do not, or we cannot help you out, or yes, we could think of that. But you're not going to know until you ask that question. Um, as someone that is, as an employer has hired many people over the years, I think when people ask questions like this, I think it shows that, people are thinking. People are thinking about their own futures, their own professional trajectories, etc. So just something to put out there as well. Um, I personally think it's foolish for agencies not to pay to help, new employees with these kind of costs. Frankly, it's pennies on the dollars in many ways. And I think it's also really it says something about the organization's culture if they're gonna do certain things like this as well. So okay, sort of jumping back to the issue of testing. Um, Obviously, COVID, like everything else, is sort of just you know made everything sort of different, complicated, etc. And that includes taking the exam. So right now, and this is the site to go to, which will provide up-to-date information on what testing sites are currently open to take the test. Unfortunately, and I don't know too many professions that allow it, but there is no encrypted software, etc., that would allow you to take this licensing exam from your own computer, which would not necessitate you going to a testing center. I guess depending on where we're at with our level of where the state is as far as test positivity and all that other stuff, that's going to all depend on on testing centers opening up. And obviously, there's less people that can sit in the testing center than before, and there are obviously protocols as well. So that unfortunately is also slowing the process down as well. So I would the ASWB site is where to go to see what the situation is with the availability of testing sites and COVID. All right, I'm not going to spend long on this, but suffice it to say that we all learn differently. Okay, some of us are really good at taking sort of standardized tests. Some of us, it can be kind of daunting. I would include myself in the daunting category. I have been my entire life. Don't do very well on these kind of tests. So that, however you feel comfortable in learning, is really going to determine how you actually prepare for the test. Now, you're all gotten a really good education at Jane Addams, but this is a test. So sometimes it helps to either take a, now virtual prep course, which some, NASW provides, other people provide courses like this. There's a lot of online, test question, sample questions. They're testing apps now. So it really is all about how you learn. Okay. So, that's going to determine how you prepare for a license exam. We all know people that can go, look at some practice questions and then go out the night before, on the town or to bars or whatever, and then do really well in the test. Some of us, that's not the case. And so some of us have other whatever challenges with this stuff. Again, I've said myself included. So it just really depends on how you learn. We have NASW has a review course, and what used to be a one-day in-person course, we now are doing it virtually until further notice, and we split it up over 2 days. And the next one of these courses is next month, May 13th through the 14th. Okay, so this is just, I'm going to try to just go through the next couple slides, and then what I really want to do is open it up for questions, comments, etc. from everybody. So this is all, it's just the steps you need to do once you pass the test and, the application and getting your license and all that other stuff. These are the things that you are then bound by. You're bound by our Social Work Act, which is the our Practice Act, our statute. You're bound by the related rules to our statute. You're also bound by the Illinois Mental Health Code and the Code of Ethics. The Code of Ethics is specifically mentioned in the social work rules. So this is pretty serious stuff too. Now, the bigger question and the question of the day of the year, and has been for a couple of years, but now COVID has sort of just catapulted this in, is the issue of reciprocity, okay, in licensure reciprocity. So there is not any direct reciprocity between states, but right now, due to COVID, each state has had emergency orders that have made it or created some greater flexibility around licensure. Okay, so right now, so for instance, if I'm an LCSW in Illinois and I was seeing a family or an individual, and that individual decided to move to Michigan to be closer to family during COVID because they could work remotely, it could very well be that Michigan is going to make it a little bit easier to grant either a temporary license, etc. There is a national movement right now to establish what are called licensure compacts with the social work profession. This is really going to be your issue because telehealth is now here. It's not going away. In fact, because of COVID, we realized many of the benefits of telehealth. We also realized some of the challenges with it. But this is going to be really part and parcel of all of your practices, in the future. So you need to really keep an eye out about this as well. So, etc. Okay, so. All right, so this is just a little bit, and with this, after this, we'll take questions. Once you get licensed, it's a lifelong process. I mean, the way licensure and other professions are like this too is that you have to continue to be a lifelong learner, and that's what continuing education is all about. So every 2 years, social workers renew their licenses in the odd number year. Now, you can probably say the past year and a half or 2 years have been rather odd, and they have. But the odd number year means that our licensure cycle, our current licensure cycle, ends November 30th of this year, 2021. So here in Illinois, and this varies between states, social workers need 30 hours of continuing education. Now, many of you have probably seen in your field placement, or if you're also working, your agency may provide in services, which provides CEUs. 3 of those 30 hours have to be in the area of ethics, and since December 1st, 2013, 3 hours have to be related to content that's related to cultural competence. Also, since 2013, 50% of your CEUs have to be attained face-to-face. That was waived this year due to COVID. So for this licensure cycle, that is not the case. So they can be live virtual CEUs And who knows what's going to be the next licensure cycle and where we're going to be vis-a-vis COVID and getting back together, etc. For all of you that get your license, say if you're going to get the first time you get your license, it's considered a grace period, so you're not responsible for accumulating your CEUs. CEUs are basically an honor code system. So you should just guard your CEU certificates with your life, or put them on some file or cloud, because the state, when it has the ability to, will run random audits. And lastly, there are 2 new requirements here in Illinois. At least one of the 30 hours has to include sexual harassment prevention training, and a mandated reporter training is also required for licensure renewal. All right, here's some propaganda about NASW. In the big picture, it's also when employers are looking at everything, it's really important to be connected to your professional association, just for all kinds of reasons. For the benefits, also be in tune with important legislation and trends, etc. So, all right. So I said I was going to get through a lot of material really quickly, and I did. So let's, why don't we open it up for questions? And I already see a hand up here. Alexis, right?
Hi. Okay, so my question pertains to the application itself, because I started filling it out. So this is for pre-approval, correct? Because I can't sign up for the exam until I've turned in the application, right?
Let's go back through the steps. So first of all, and I guess perhaps Rachel can chime in here. The college will be sending all of your information down or conferring your degree with the Illinois Department of Financial Professional Regulation shortly after graduation. Okay. And Rachel, I don't know when that is. I don't know when graduation is. I'm sure you all know when graduation is, what time, what hour, what minute. So I don't, but that usually will happen maybe a couple weeks after graduation as well. So, so that's the first step. Then as far as there's parts of the application that need to be completed by you, and also the parts that need to be completed by the university, okay? Then you get pre-approved. Once you get your pre-approval, that's when you can sit for the exam, okay?
Okay, so so my questions then are, for the part 7 on the application, it says examination coding information, and it asks you to put in the exam you desire and the test codes, but we don't have that, right?
Okay.
So we don't fill that out?
Yeah, well, no, you'll get that from, I mean, the college will provide that. There are 2 levels of tests. The LSW is the master's level exam, and then the LCSW is obviously the clinical level. I don't know exactly what the code is, but the college should be able to help that with you. And let me just say too, with any of these questions that we're getting right now, please feel free to email me directly if I'm not able to provide the answer to you right now. Okay?
Okay, so that part will get filled out after we hear back from the college. So I can't send this in until the UIC gets back to you?
Yeah, your degree has to be conferred by the college first. Okay? You can't do this until you have they have that information in Springfield.
Okay, and then who do we send the educational supplemental information to? Where at UIC?
Okay, Rachel, you wanna hop in here?
Yeah, I'm sorry, I'm typing in the chat, but it's going to be sent to Hazel Brown. She's the record supervisor, and I will put her email address in the chat, and I'll send it in the Gmail as well.
Okay, thank you.
Okay, so let me go to the chat first and try to address some of the questions in the chat. So if we get our license in Illinois, is it valid in other states or no? Okay. Generally, yes. What happens is, and this is Diana who just asked that question. So Diana, if you get, say, your LSW here in Illinois, and then you decide in a couple of years to, or sooner to move to whatever, California, you need to contact the California Social Work Board. I would start with the NASW chapter there to find out there's obviously an equivalent to the LSW in another state, okay? That piece needs to be, you need to do that regardless. If you are thinking of moving to another state or taking a job in another state, because you don't want to get to another state. Say you get your LCSW in a couple of years, and you have your dream job, you pack up the car, you move to wherever, and you realize that you hadn't gotten your all the acceptance from that social work board, you're not going to be able to practice. Okay, so that's what I would suggest. Again, that's the issue, that we don't have licensure reciprocity, and that's the problem. Okay. All right. Varsha's asked, how do we register for the LSW review card? You just go on our website, NASW-IL.org. Let me keep going down the questions here. Yeah, unfortunately, you have to renew. When you renew your license every 2 years, you have to pay. Unfortunately, that's the cost of being a professional. Okay, Laura asks, if you get our LSW May 2021, do we need to renew in 2021, or does the grace period cover that? The grace period covers the period from now until November 30th, but I'm going to double check on that as well. Okay, Rachel just put the official degree conferral date is May 9th. Okay. All right, so that's that. Okay, let me go down to Ray's question about, is it necessary to begin working in the field, receiving clinical supervision within a certain time period after graduation? Is it possible to take some time off post-grad and get a job later in the year? Of course it is, Ray. You deserve it. Go to a beach and read and take it easy. But yes, you can, take the summer off and then start in, because that's what sometimes a lot of people do, just to sort of to have some necessary time off. Okay. How do we log and where do we submit our supervised hours for our LCSW? Well, there's you don't log into the to the IDFPR website. Generally, your supervisors are going to have your clinical supervisors are generally going to have forms that are going to have records of the 4 hours per month that you're meeting. Okay, so those are really important to keep. And as I said during the presentation, you can also have multiple supervisors as well. Okay, who can give us feedback regarding whether or not the work we're doing on or the job that we have qualifies as hours towards our LCSW? Okay, so as I mentioned before, A, I think you need to be talking to your clinical supervisor, but B, if you have specific questions about that, you can contact me. We a lot of times have some of our folks that do a lot of our supervision training, can confer personally with people and sort of go over to make sure that if it does seems to be a little bit of a gray area, that can be as well. Sheila, so what if we only get supervision 2 to 3 times a month, or does it have to be weekly, or for 1 hour? It has to be 4 hours a month. Okay, so does it have to be every week? It needs to be 4 hours a month. I will double check, but usually it doesn't mean that it has to be 1 hour on Tuesday at 4 o'clock every Tuesday. It can possibly mean, a couple other days, but I will double check on that. But again, with all these, please email me to remind me too on some of these things. Laura asks, can you have 2 part-time jobs and use 1 clinical supervisor for both jobs? Yes, that is generally would be fine. Monet asked you, do you have to have 30 CEUs per year, or is it every 2 years? It's every 2 years, Monet. That is our licensure, our license is for 2 years. So it's for 30 CEUs over a 2-year period. Okay, so I went through that chat very quickly. So any other questions that people actually want to speak and ask?
Yeah, I just have a quick question, I guess, to confirm something that you said. So with an LSW, we can definitely not, we can't practice in a private clinic then, correct?
You can practice under the supervision of an LCSW, okay?
Okay, and if
So
it's not,
it would almost be Courtney, even if you didn't get your LSW and you took a job at, I don't know, a group practice, you would be working there under the supervision of an LCSW, accumulating your clinical hours, or the equivalent of, say, you took a job at a community mental health center, you're doing clinical work. You decided, I'm not going to take the LSW, I'm just going to wait and take the LCSW. You'll be practicing clinically, but you will be supervised by a clinical social worker. I'm not going to go into all how that works with billing, because that sometimes that's something that your supervisor, the group practice, is going to have to work out with the insurance company too. Okay.
okay, thank you.
Yeah.
I have a question. I think someone asked this, but I wasn't sure about it. But since you have to do a renewal every 2 years on an odd year in November, does it make sense to try to get the LSW, like say in June this year, or just wait until November? Like if we get it in June, do we have to renew it in November?
Yeah, good question. It's always good to try to beat the system. So the fact is that Sheila, the way things are going now and how slow things are taking, it may be just worth it to just wait till after the licensure cycle to do that. Sometimes people do that right after the licensure cycle, then they don't have to accumulate CEUs for that grace period. But it really is going to have to, it actually may depend on, say, your employer. I mean, your employer may just say, we really want you to get the LSW. We know it's taking time, but you may have to get that LSW sooner than you think. It just depends on everyone's, where they end up working and and where that, if it's a hospital, they're probably going to say, yeah, you need an LSW, or you need to be working on getting that, etc. Right now, everybody understands that things are slower than what they used to be with getting a license. If they don't understand that, they may not be an organization you may want to work for either. So
I was curious how much the review session, the 2-day, I don't know, crash course is.
Are you asking if it's worth it to take a review course?
No, how much, do you have to pay for it?
Yeah. Unfortunately, you got to pay for that too. So
yeah. So I was
yeah.
curious if you know how much it is.
Well, there's the membership. It's a 2-day course. It's 8 hours. The membership rate, I believe, is $190. And this is also something that if you wait to do that it's maybe something that your employer may also help you out with too. And I mean, there's comparable. There you go. Thank you. I'm only the executive director, so I should have known that, right? But what you probably need to do and figure out is when you feel you're going to be ready to take the test. I mean, some of you may want to already take a review course in the coming months, or if you're thinking of waiting a while to either take if you're waiting, 4 or 5 months to take the LSW, you may want to take that review course, whether it's NASWs or another, closer to the time, closer to the time that you think you want to be taking the test. Dorian, you just asked a question about how often or the frequency of the test. Yeah, we offer it probably 4 or 5 times a year. And there's a lot of stuff online too, if that's the route you want to go as well.
Also, I think someone asked us in the chat, but their mic isn't working. But if a family member has their LCSW, can they supervise us and sign off on the hours?
If someone has an LCSW,
Like a family member?
sure, if they have an LCSW, if you have the ability to for someone to supervise you and it's not within your work setting and you don't have to pay for it, then and someone's willing to do that, go for it.
Hi, I know somebody asked about the license applying to different states, but to clarify, does that mean that I know we'll have to contact the state's board or even the NASW with the state, but does that mean that we'll have to take another test within that state as well?
No, so there's 2 scenarios here, Monet. One is if you're thinking of moving now or shortly after graduation, you may want to just have your test scores sent to that state, okay? If you're thinking of, staying in Illinois for the next couple of years, then you get licensed, you start working. One of the things you just need to figure out from that other state is, the equivalent in most states. Obviously, there's an equivalent of the LCSW in Iowa. There's the equivalent to the LCSW in Oregon, and et cetera, et cetera. You almost rarely have to take the exam again. So I wouldn't be too concerned about. What I would just be vigilant about is that if you are down the line thinking of moving to another state, get all that stuff taken care of before you move and take that job.
Gotcha. Thank you.
I have a question. Go ahead.
Sorry, could I just answer sorry about that. Let me just answer the question, the latest question in the chat. I believe that there is the pre-approval is for 1 year. Go ahead. I'm sorry, Andrea.
Oh, no problem. In terms of supervision, if you get like part of your supervision hours in one state and then you move somewhere else and you complete yours, do you have to start again with new supervision hours, or can you just like maintain your documentation from your supervision from the one state and take it to the next?
As long as those supervision hours are from an LCSW, that generally is going to translate to the equivalent of that other state that you're moving in or getting but all this is that you all have to do your due diligence on this. Don't take anything for granted that it's just going to be, it's going to be fine. You just have to be really vigilant about this.
Any other questions?
I'll throw out one last question that has to do with that pre-approval period. You stated that the pre-approval is good for 1 year. Do you mean that like after we graduate, we're pre-approved for 1 year following that, but if we wanted to like apply for the test after that, we'd have to get approved again?
Well, it depends, Andrea, if you're thinking of taking the LSW right away, because that's something that you can do without supervision. I would just figure out what exactly your plan is. For the LCSW, it's going to be a while off. If you're deciding that that's the route you're going to take, then it's probably at least 2 to 2.5 years down the line. Okay. So I think if you're thinking, okay, I'm going to do that, get a sort of a general plan of when you want to take the test, that's what I would suggest.
I just want to clarify one thing. So we cannot complete any of the applications for the pre-approval until after graduation, correct?
Correct.
Okay, thank
Yeah.
you.
And part of the reason why we pushed to get this legislation passed 2 years ago, so that people wouldn't have to have this long wait. It was sort of an end around of the process that actually IDFPR was fine with, but then we ran into this problem with the Association of Social Work Boards. So yeah, unfortunately, that's still the case, Amanda. All right, everybody, good luck and hang in there.